So good morning. The first item of business is general questions. Our first question from Ruth Maguire.
Thank you, Presiding Officer. To ask the Scottish Government what steps it takes to ensure that its policies and legislation protect and promote the rights and well-being of children and young people.
Minister Marie Todd.
Protecting and promoting the rights and well-being of our children and young people is fundamental to achieving our national outcome, that we grow up loved, safe and respected so that we realise our full potential. In 2015, we introduced the Child Rights and Wellbeing Impact Assessment approach to support all Scottish ministers in meeting their duties in relation to the UN Convention on the Rights of the Child set out in the Children and Young People Scotland Act 2014. It helps to assess whether proposed policies, measures and legislation will protect and promote the rights and well-being of children. The recent programme for government clearly demonstrates the priority we continue to place on supporting our children and young people to thrive in these uncertain times. Importantly, it reaffirms our commitment to incorporate the UN Convention on the Rights of the Child into domestic law and to bring forward legislation within this parliamentary session. We've also made clear our commitment to getting it right for every child, which remains at the heart of our approach to promoting the well-being of Scotland's children and young people.
Ruth Maguire.
I thank the Minister for that answer. On the 20th of June this year, in a statement to Parliament, the Scottish Government committed to replacing schools' guidance on transgender young people with guidance from the Scottish Government themselves that will be inclusive of all children and won't risk excluding girls from female-only spaces. Does the Minister agree with me that the use of a child's rights and wellbeing impact assessment in policy and guidance formation is the very best way to ensure all children enjoy their rights as set out in the UNCRC? And further, would she agree with me that any organisation working with or advising those working with children and young people should be held to these best practice standards that protect and promote the rights and well-being of all children?
Minister.
In June this year, the Scottish Government confirmed that we'll bring forward updated guidance to support transgender young people in our schools. Work's underway for this to be available by the end of the year, and this will include completion of an EQIA and a CRWIA. Since its introduction in 2015, the Child's Rights and Wellbeing Impact Assessment has been a really valuable tool in ensuring that we protect and promote the rights and well-being of children and young people. It allows us to identify potential negative impact in relation to proposed policy and legislation and to take action to mitigate this. An example of this is in relation to the Stop and Search Code of Practice. The CRWIA and the responses to the consultation shaped revisions of the draft code and identified a need to include a separate section dealing exclusively with children and young people.
Thank you. Question 2 has not been lodged. Question 3, Gillian Martin.
Thank you, Presiding Officer. To ask the Scottish Government, will it provide an update on progress with personnel recruitment and facilities in Aberdeenshire for the expansion of funded childcare to 1140 hours?
Minister Marie Todd.
The Scottish Government wants children and families right across Scotland to benefit from extra access to high-quality, nurturing early learning and childcare. We're investing an additional £2 billion to realise our ambition through a landmark funding deal with COSLA. By 21-22, Aberdeenshire Council will receive nearly £26 million of additional revenue funding for early learning and childcare, which will support the expansion of the early years workforce. And over the next 5-year period to 2021, Aberdeenshire Council will benefit from over £27 million of additional capital funding to build, refurbish and extend nursery facilities. Yesterday, the Improvement Service published further progress data showing that over 46,000 2-, 3 and 4-year-olds nationally are already benefiting from extra funded early learning and childcare. The data demonstrates that local authorities across Scotland, including Aberdeenshire, are working incredibly hard with nurseries, playgroups, childminders locally to prepare for August 2020, and that the recruitment and infrastructure development continues to progress well.
Gillian Martin.
I thank the Minister for that comprehensive answer. Trained personnel are, of course, only one part of the equation. Can the Minister give an update on where we are nationally with improvements to availability and condition of estate needed to deliver the 1140 hours? And what's been done to assist private partner providers in helping us meet the challenge in terms of both recruitment and facilities?
Minister.
We're investing £476 million for new, refurbished and extended high-quality ELC settings. Yesterday, I visited Sochi Nursery in Alloa, where I saw the benefits of this investment firsthand. Clackmannanshire Council used some of their capital funding to extend Sochi Nursery to have a kitchen and dining facilities. Children now have cooked, hot, healthy meals provided on site. We expect 900 such projects, large and small, will be delivered by the end of the expansion. In July, we set out the support that each local authority offers to private providers. Through our funding deal with COSLA, we're delivering significant increases in hourly funding rates, which will enable the payment of the real living wage to all childcare workers delivering funded hours from August 2020. Many private nurseries can also now benefit from the 100% business rate relief, and we've enabled private and third sector providers to post job opportunities for free on My Job Scotland website.
Alison Harris.
Thank you. I'm pleased to hear the Minister's response to Gillian Martin. However, in a recent survey of the PVI sector, when asked, around 80% of respondents stated that they're having great difficulty in recruiting and retaining trained staff, as local authority nurseries are able to offer a much higher rate of pay. This is largely due to local authorities using a higher revenue funding rate per child for their own services than they allocate to PVI providers. So what can the Minister offer the PVI sector to assist them with this ongoing staffing crisis?
Minister.
So, as I've said from day one of this, since I became Minister, private providers will be absolutely crucial to the delivery of this expansion. And we've put in place a number of opportunities, training opportunities at college, on the job, modern apprenticeships and at university, so that there's a vastly increased number of people qualified within the sector. We've also, through the agreement with COSLA, ensured that there is a sustainable rate being paid to private providers so that they can pay the living wage and compete with the local authority providers in future.
Thank you. Question number 4, Linda Fabiani.
Thank you. To ask the Scottish Government when it will take decisions on the implementation of cold spell heating assistance.
Cabinet Secretary Shirley-Ann Somerville.
We are putting in place robust plans to deliver cold spell heating assistance from winter 2021. A priority in taking on full responsibility for all the devolved benefits is a safe and secure transition so that people continue to receive the support at the right time and the right amount. Over the course of the next year, we will be seeking the views of people who have benefited from cold weather payments in the past as part of our commitment to designing our new social security system with those who are likely to use it. In addition, we will seek a wide range of expert opinion and look to design processes that better reflect the needs and experiences of the people of Scotland.
Linda Fabiani.
Thank you. Presiding Officer, I was pleased when the Cabinet Secretary previously said that she would review how eligibility payments for payments, in fact, is triggered, including the number and location of weather stations. That was very welcome in a town like East Kilbride, which is currently judged from the weather station in Bishopton, which is at sea level and therefore often much warmer than East Kilbride. So I would like to ask the Cabinet Secretary when we can have confirmation of the weather stations having been reviewed so that my constituency will no longer be disadvantaged.
Cabinet Secretary.
Well, I'm very well aware of the calls for more localised forecasts and additional weather stations, and most particularly from Linda Fabiani, who has been determined to take this case forward for a number of years now. As I said in my original answer, over the course of the next year, we will be seeking views of the people who have benefited from the cold weather payments, and that is to ensure that we can develop our policy around the cold spell heating assistance that is the most appropriate, the most active, the most cost-effective ways of ensuring that the weather forecasting and monitoring that we have is targeting the support and the assistance on those in greatest needs. And that will, of course, include a review of eligibility for payments and how they are triggered, with the number and location of weather stations being very much part of that process.
Question number 5, Michelle Ballantyne.
Thank you, Presiding Officer. To ask the Scottish Government what impact infrastructure failures at the Queen Elizabeth University Hospital and the Royal Hospital for Children and Young People has had on patients who are on surgical waiting lists.
Cabinet Secretary Jean Freeman.
No patients who are on surgical waiting lists at the Queen Elizabeth University Hospital and the Royal Hospital for Children and Young People have been impacted by the infrastructure issues at these two hospitals. NHS Lothian have confirmed infrastructure issues at the Royal Hospital for Children and Young People have had no impact on patients on surgical waiting lists. There were a number of theatre lists cancelled before and after the original planned move date as part of the agreed migration plan, but in terms of the issues themselves, there has been no impact.
Michelle Ballantyne.
Thank you. That's an interesting answer. 15 months on the neurosurgical waiting list, 11 on the short notice list because of persisting severe pain, still no operation. My constituent felt he had no choice to pay to have his operation undertaken privately. His surgeon's explanation, a lack of trained theatre nurse, responding to emergency work and infrastructure issues including sewage ingress and delays of over 18 months to get access to new theatres at the Queen Elizabeth University Hospital. My constituent is watching this session. He is angry, out of pocket and feels let down. What can the Cabinet Secretary say to ease his anger? And does she know how many other patients have sought private treatment because of the waits they have faced?
Cabinet Secretary.
I'm grateful to Ms Ballantyne for that supplementary question. If she would care to write to me or had written to me before now, I would be able to give her a more detailed answer on the particular case that she is raising. But in the absence of doing that, it seems to me from what she said that she is referring to the neurosurgical theatres, which were responsibility of Glasgow University to plan and build. We've discussed this before in this chamber and elsewhere about the inadequacy of the original plan and build to meet the standards that NHS require. I now understand, following important intervention, very helpful intervention from the principal of Glasgow University, that work has now been undertaken to standard, and I believe that Greater Glasgow and Clyde are about to take possession of those theatres, at which point they will be able to be used for patients.
Thank you. Question number 6, Adam Tompkins.
Thank you. To ask the Scottish Government whether it will provide an update on the action it's taking to address the use of non-prescribed benzodiazepines such as etizolam in Glasgow.
Minister Joe Fitzpatrick.
This is not just an issue in Glasgow, but in communities across Scotland, and is one of the matters that the Drug Death Task Force will consider as part of its work. Glasgow Health and Social Care Partnership put in place a number of measures earlier this year, including specific outreach activity and providing harm reduction information specifically on the so-called street Valium. They also implemented a treatment protocol for the management of dependents associated with the use of street Valium for those most at risk. Nationally, Police Scotland, NHS, health boards and funded agencies have sought to increase awareness of the dangers of taking prescription-type drugs, including the so-called street Valium, through national warning bulletins, messages on social media and local information campaigns.
Adam Tompkins.
Thank the Minister for that answer. Street Valium costs less than a chocolate bar to buy. What is the Minister's reaction to evidence, including from Police Scotland, that one of the unintended consequences of minimum unit pricing for alcohol is to have pushed people with problem alcohol use to switch to cheap drugs such as benzodiazepines?
Minister.
Concerns regarding the availability and use of street Valium predate the introduction of minimum unit pricing, but we know that the key drivers in recent increased numbers of deaths associated with street Valium is the extremely low price of the pills. Mr Tompkins talked about a bar of chocolate, but reports are as low as 20 pence a pill, and there's increased evidence of poly drug use. However, clearly the NHS Health Scotland are looking closely at all of the implications in relation to minimum unit pricing. And one of the studies that they are doing assesses the impact of minimum unit pricing on those drinking at harmful levels and includes considering substitution with other substances. So it's something that we absolutely will be keeping an eye on.
Bob Doris.
Thanks, Presiding Officer. Minister, I have been informed of significant issues in seeking support for benzodiazepine dependency from health services, including GPs, which can force some into the hands of dealers pushing potentially deadly so-called street Valium. Will the Minister look at how health services can better help those with such a dependency?
Minister.
Health services and GPs in particular have a significant role to play in helping tackle the challenges we're seeing with drug use and the associated health harms, and the Royal College of General Practitioners are represented on the Drug Death Task Force. It's the role of GPs to assess the clinical needs of their patients using relevant evidence to take a person-centred approach that identifies their preferences and where it's clinically appropriate to do so. To follow these, there are clinical guidelines in place for the management of drug misuse and dependence, and we'd expect clinicians to take this person-centred approach as advocated in our alcohol and drug strategy in issuing issues relating to addiction to any types of drug.
And Polly McNeill.
Street drug use has been primarily responsible for the HIV outbreak in Glasgow with injection of both heroin and cocaine. Scotland, of course, was the first part of the UK to make the drug PrEP available on the NHS, a game-changing drug, but perhaps not many people are aware of it. The Minister will be aware that it's taken by people who have HIV negative, but it has been shown to reduce the risk of infection by up to 86%. Would the Minister tell Parliament what the Government is doing to raise awareness of the existence of the drug PrEP to drug users?
I thank Polly McNeill for what is, I think, a very important question. I was pleased to visit Waverley Care in Glasgow, who are one of the partners that we are working to try and reach people who have been more difficult to reach, particularly in terms of in Glasgow where there's this particular issue. But I think it's a really important point, and I think we can all do what we can to make sure people are aware of the benefits of PrEP for people who could benefit from it, but also raise awareness of the fact of the U=U campaign and how it is possible to really remove the stigma around HIV, and we have treatments in place, and we have this PrEP, which is a preventative approach.
Question number 7, Mike Rumbles.
To ask the Scottish Government whether NHS Grampian will receive its full share of NRAC funding in the next Scottish Government budget.
Cabinet Secretary Jean Freeman.
The Scottish Government will publish its spending plans in due course as part of the Scottish Budget. Under this Government, NHS Grampian's budget has increased by almost 30% above inflation, and the Board is receiving record investment this year in excess of £957 million. In 2019-20, Scottish Government continues to ensure that no board was greater than 0.8% from NRAC parity.
Mike Rumbles.
Well, Cabinet Secretary, 0.8% sounds great, doesn't it? But the Scottish Parliament Information Centre has confirmed that over the last 10 years, the Scottish Government has given NHS Grampian £239 million less than it was supposed to receive under the Government's own funding formula. This has led to 30% of patients waiting longer than 18 weeks for treatment for chronic pain and cancer treatment times not being met for a quarter of patients. Will the Cabinet Secretary find at least some of this missing £239 million to put the situation right?
Cabinet Secretary.
So I have to point out to Mr Rumbles that NHS Grampian is a great deal closer to parity than it ever was when his party was in government in Scotland. Can I also point out to him that the significant additional funding that NHS Grampian has received, that being 0.8% away from parity for NHS Grampian or indeed from any other board, is not, in my opinion, a sufficient reason, given the additional significant investment in waiting times and in other areas for any board to continue to fail to meet its targets. We've had this discussion before. And can I also point out that in moving NHS Grampian closer to parity, in the same position as other boards in that area, between 2015-16 and 2019-20, they have received an additional recurring funding of £56.2 million. That, I think, places NHS Grampian in a good position in order to deliver for the citizens of that area the healthcare they deserve.
Tom Mason.
Thank you, Returning Officer. Sorry. Thank you, Presiding Officer. My apologies. I was caught up in elections in Bridgend and Aberdeen. Anyway, NHS Grampian has recently missed its targets for delayed discharge. A&E waiting times, drug and alcohol treatment waiting times, chronic pain waiting times, and an 18-week referral to treatment. Since the NRAC formula was introduced in 2009, NHS Grampian has never reached NRAC parity. resulting in a total shortfall of £239 million over that period. Does the Cabinet Secretary not accept that these two things might be just related?
Cabinet Secretary.
No, I don't. And the reason I don't is because other boards are in the same position and are performing in a better way than NHS Grampian, as indeed NHS Grampian is performing better than other boards. The fact of the matter is the real focus, which is why we have that £850 million additional investment in waiting times, why we have the additional investment in mental health services and care, is because our focus with those boards is on that trajectory. If the member would care to go back to the waiting times plan I published last year, on that trajectory to improve that performance and meet those waiting times. So much of it is down to service design and delivery, and not as much as members might care to argue in terms of the resourcing that our health service receives, which, can I remind members, is the highest it has ever been since this Parliament reconvened.